Dr. Frank Contessessa is here to answer our latest COVID questions. He's an internist at Northwell Health. Doctor, good to see you. So the Education Secretary, Miguel Cardona, appeared on CBS Mornings earlier to discuss how the government is working to better equip schools amid outbreaks. I want to play a bit of what he was saying. We'll talk about it.
We're prioritizing our schools. We recognize that schools are the hubs of the community, that we should not be closing our schools first. As Dr. Walensky said, it's vital for our students. So you're going to see distribution of tests as early as next week to make sure that our schools can stay open.
Doctor, given the increased commitment to testing, what would you say to a parent who's concerned about sending their kid back to the classroom?
Well, first of all, good morning, and I thank you for having me. It's nice to be joining you this morning. Well, first of all, I completely agree with the Secretary that the schools need to remain open. The schools, the children need to be face-to-face with their peers and with their teachers. They learn better that way, and their socialization is much better. Parents should not be fearful at this point. Thankfully, COVID is not a tremendous threat to children. Their chances of dying from COVID are pretty close to zero. A healthy child has a greater chance of dying in a bus crash on the way to school than they do from COVID. So we have to start treating this basically like we do during flu season. You know, if there's a lot of sick kids in class, then there should be some caution. Testing we have to be a little bit judicious with testing. I find that my patients are over-testing these days. There's a lot of paranoia. And with the flood of home tests that are about to come, I fear that people are going to be testing every other day when they're asymptomatic. If you're symptomatic, it's reasonable to do a test. There's a good chance right now that if you have cold-like symptoms, you probably have Omicron. But there shouldn't be fear because by and large, Omicron has been showing to be the mild illness that the rest of the world told us that it would be.
Doctor, why is over-testing bad? Maybe you're asymptomatic and it picks up something.
That's true, but let's be also cautious because these home tests are geared towards picking up coronaviruses, right? But you can have false positives just with a common cold. And that can cause, an avalanche of, quarantines with classmates. So I'm not saying we shouldn't test at all. But if you're asymptomatic and haven't had a reasonable exposure, then I wouldn't just test for the sake of testing.
So, Doctor, let me just go back to something that we were talking about, which is children in schools. Most parents want to see their kids in school, but as you know, the United States has hit a new record for the number of children that have been hospitalized with COVID-19, and specifically in Texas, they've seen a 600% increase since mid-December among kids 18 and under in hospitals. So I know that perhaps Omicron is not as deadly as Delta has been and was and is, but what do you say to those folks who are worried about their kids ending up in a hospital like the numbers that we've seen recently?
Sure. Well, first of all, I noticed that you said, admitted with COVID instead of because of COVID. Mm-hmm. So we really have to nail down those numbers a bit more carefully. In the hospitals that I'm associated with, we have not seen the kind of increase that they've seen in Texas. And again, the rates of death and serious illness remain low. They remain low. So I really want parents to be calm. And again, if there's an outbreak in school, then people should stay home when they're sick. But we really have to quell the fear that I'm really sensing that a lot of the fear porn industry is putting out there. This will be, in the next few months, basically the flu. So I want people to start treating it that way because deaths are not increasing right now. And in some parts of the world, they're actually decreasing, even though you're seeing an avalanche of cases, and we are. The cases are skyrocketing. So when you see the counters, yes, 1 million cases, that's absolutely true. By and large, the vast majority will be sick for 2 or 3 days. They'll feel like they have a bad cold, and then they're going to get better. This is a good thing in the long run because we'll start to see the broad-based herd immunity that we're all so desperate to see.
Yeah, and you're just drawing a distinction because you pointed out the number of children hospitalized with COVID-19. You're drawing the distinction that sometimes children can be admitted to the hospital for something else, and then I guess hospitals test for COVID-19 while you're admitted for something else, and then you discover that a child is infected with COVID. That's what you're talking about, right?
You're exactly right. Let's say a child gets admitted for appendicitis, and they happen to incidentally test positive in the emergency room because they're swabbing everybody, and they incidentally test positive for COVID. That's a COVID admission.
Got it.
And we really need to parse this so that there's no confusion. Some studies have shown that 40 to 50% of the numbers that are being reported as COVID cases are COVID cases with COVID instead of because of COVID. CDC has come out with this just in the last few days.
Got it.
Yeah, in fact, we were looking at statistics right now. That was going to be my next question, but you basically covered it. But just to sort of reinforce that, it's not just children. Kaiser Permanente, a study by them out of California, found that over 52,000 patients with Omicron, only 235 were admitted to the hospital. And none of them needed a ventilator. Sorry, that was not the statistic I wanted to bring up. But I think that we should talk about that. The fact that people are getting sick and they may be showing up at the hospital, but they're not being admitted. And most importantly, they're not taking up beds. They're not being put on ventilators.
That's absolutely true. I get a morning report from the hospitals that I'm associated with, and the ICU admissions are not increasing. They really aren't. You sort of see a divergence when you look at the charts, even on CDC's own website. I tend to go on there most mornings before work. I like to see the statistics. And you see this steep increase in the cases. And it's it's a daunting sight when you see that line going up dramatically. But then you look at hospitalizations, there is an increase, but the slope is much shallower than the case increase. And then you look at deaths, and it's flat, and it may be even tailing down a little bit. So I can't emphasize enough for my own patients and for everybody out there listening. I know it's scary. I know everyone's telling you Omicron and the next wave and hundreds of thousands of cases. And that's all true. But by and large, and I've seen a flood of cases to my own practice, I haven't put anybody in the hospital for COVID in a month. And I've had more cases now than I had, all through the beginning of 2020 and the worst of the pandemic during the lockdowns. So I'm just not seeing it. And I really want people to be calm. We have to start looking at this like it's the flu.
And let me ask you about this. The Biden administration says private insurers will now cover the cost of 8 monthly at-home tests per person. There are some studies that suggest that these antigen tests may not be as accurate as diagnosing Omicron as they were for other variants, but it doesn't sound like you're that concerned. And are you wondering about the push from the administration for home testing? Is it necessary?
I think it's going to be a little too late. I'm expecting that the Omicron peak is coming within the next couple of week or two. If we look at the data from South Africa, they are on the downswing. The UK is on the downswing, and they preceded us by a few weeks in the surge of Omicron. So I think by the time this all gets enacted in the next few weeks, the Omicron probably will have wash over us. And again, that's a good thing. It's spreading like wildfire. It's almost like a mild storm that's coming through. It's windy and the trees are blowing, but there's not a lot of damage going to be done.
All right, Doctor. I think you put probably a lot of people at ease. Dr. Frank Contessessa, thank you so much.
I hope so.
Thanks, Doctor.
Thank you for having me. Have a great day. Thank you.